We're happy to announce that we are now permitted to have essential caregiver visits. All of our staff have been working diligently to keep your loved ones healthy and safe through infection control, education, and training. This video is intended to help you better understand COVID-19 and the steps needed to ensure safe caregiver visits.
COVID-19 is a contagious respiratory illness. It is thought to spread mainly through close contact from person to person. It is important to note that some people without symptoms may be able to spread the virus. People with COVID-19 have a wide range of symptoms ranging from mild to severe. Symptoms may appear 2 to 14 days after exposure to the virus. The following are the most common symptoms: fever or chills, cough, shortness of breath, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. The best way to prevent illness is to avoid being exposed to the virus, good hand hygiene, social distancing, appropriate use of face masks, cleaning and disinfecting frequently high-touch surface areas, and monitoring your health daily. Hand hygiene is a crucial infection control measure utilized to stop the spread of germs. There are 2 different methods you may use to perform hand hygiene. One method would be washing your hands with soap and water. Wet your hands with clean running water and apply soap. Lather your hands by rubbing them together. Be sure to lather the backs of your hands, between your fingers, and under your nails. Scrub your hands for at least 20 seconds. Rinse hands well under clean running water. Dry hands using a clean towel. After your hands are completely dry, use a paper towel to turn off the faucet. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Ensure to cover all surfaces of your hands and rub them together well until they feel dry. It is especially important to complete hand hygiene before touching your face, after using the restroom, after leaving a public place, after blowing your nose, coughing, or sneezing, after handling your mask, or after providing care. How to apply a face mask. Perform hand hygiene before putting on your mask. Put it over your nose and mouth and secure it under your chin. Try to fit it snugly against the sides of your face. Make sure you can breathe easily. How to remove a face mask. Carefully remove loops from behind your ears. Ensure to handle your face mask by ear loops only. Dispose of in a no-touch trash can. Be sure not to touch your eyes, nose, or mouth when removing, and complete hand hygiene immediately after. Please ensure to use proper respiratory hygiene and cough etiquette when in the facility. The following measures are used to contain respiratory secretions and are recommended for all individuals. Cover your mouth and nose with a tissue when you cough or sneeze, or cough or sneeze into your upper sleeve, not your hands. Use the nearest waste receptacle to dispose of the tissue after use. Immediately perform hand hygiene. Another important component of infection control practices is the proper use of personal protective equipment, often referred to as PPE. Masks are used as a barrier to help prevent respiratory droplets from traveling into the air and onto other individuals or surfaces. Essential caregivers must wear face masks provided by the facility over both the mouth and nose for the entirety of their visit. Cloth masks are not permitted. A resident must also wear a face mask or face covering over both of the mouth and nose if tolerated throughout the visit. Note, a mask does not substitute for social distancing. Essential caregivers may also be required to use other appropriate PPE recommended by the CDC guidance in accordance with the facility's policy. Social distancing is very important in preventing the spread of COVID-19. Social distancing means avoiding unnecessary physical contact and keeping a distance of at least 6 feet away from other people. Essential caregivers do not have to maintain physical distancing between themselves and the resident they are visiting, but must maintain physical distancing between themselves and all other residents and staff. As part of the continued reopening of the state of Texas, essential caregiver visits are now permitted. An essential caregiver visit is a personal indoor visit between a negative COVID-19 resident and their designated individual with no physical distancing restrictions. Residents or their legal representative may designate up to 2 permanent essential caregivers. An essential caregiver can be a family member or other outside caregiver, including a friend, volunteer, private personal caregiver, or court-appointed guardian to provide regular care and support to a resident. Essential caregivers must be at least 18 years of age. Essential caregivers must meet facility COVID-19 testing requirements per county positivity rate. They must complete specific facility training. They must sign an essential caregiver agreement indicating complete understanding of policies, procedures, and regulations that must be followed when permitted access to the facility for an essential caregiver visit. They must comply with screening process prior to entering facility. They must also have their picture taken to document their identity. They must wear an essential caregiver badge provided by the facility for the duration of their visit, and they must wear a face mask. An essential caregiver visit is not allowed if the resident or essential caregiver has an active COVID-19 infection, essential caregiver exhibits signs or symptoms of COVID-19 or other communicable disease, essential caregiver fails to comply with facility policy and regulations regarding essential caregiver visits.
Thank you for taking the time to educate yourself on safe caregiver visits and COVID-19. On your first visit, you'll be asked to sign a caregiver agreement attesting you have watched this training video. We kindly ask for your cooperation and compliance to ensure the safety of our residents and staff. We are thrilled to have you back, and we look forward to seeing you very soon.